Friends, today's case is of hysteroscopic removal of written product of conception. Now, this patient, 26-year-old para 1 full-term normal delivery, had a 7 weeks of amenorrhea and she had spotting PV since last 7 days. She came to our clinic, we did a transvaginal sonography and found the written product of conception. So we asked her to get it evacuated. Now, we usually do this under hysteroscopic guidance only, and since we have a HTRS, that is hysteroscopic tissue removal system, we get all the patient with written product of conception done with HTRS. Although this procedure has been mentioned as an office procedure, we did it under aseptic precaution and in the operation theatre, but remember, no anesthesia was given to the patient, not even the paracervical block. We did a diagnostic hysteroscopy with 2.9 mm 30-degree hysteroscope with 5 mm continuous flow operative channel sheath, the distension media being normal saline, and the pressure in the hysteropump was kept at 70 mm of mercury. This is the picture, this is the product of conception lying on the posterior wall attached to the fundus. After completion of the procedure, we inserted TrueClear 5, which is a smaller version of hysteroscopic tissue removal system, and it belongs to the company TrueClear. Now the diameter of the TrueClear 5 with the external sheath, that is outer sheath, is 5.7 and without the outer sheath it is 5.1. It is 0 degree but it is fiber optic. So it gives a ground glass appearance. The vision is not that clear, but it is okay for the smaller procedures. The blade which we use for TrueClear 5 is mini incisor blade, which is also called as mini soft tissue shaver. The diameter of this blade is 2.9 mm. The movements are rotatory. The cutting window volume is around 5 mm. It cuts and aspirates the tissue. Now we are entering the uterine cavity with TrueClear 5, which is a 0 degree telescope, and it's a fiber optic. That's why the vision is like a ground glass appearance. Now here we can see the product of conception on the posterior wall. We have inserted the mini incisor blade and it has got a rotatory movement, and it slices, it cuts, it aspirates simultaneously. The blade's proximal end has a suction which goes into the suction machine and it sucks the tube and the material gets collected in the suction machine. So it cuts, it aspirates, it's a mechanical and it's under your visual control, unlike the plain blind DNC, which is actually outdated now. In a gynec patient also we do a DNC, which is also called as hysteroscopic directed curettage with the mini incisor or with a big blade also. So in a no time under vision, the products of conceptions are sliced, cut and aspirated. We are partially removing the normal endometrium or deciduum, whatever you call, from the adjacent part of the product of conception. So the cavity remains clean. Remember, this is under vision. And usually it takes less time than plain DNC or suction evacuation. This is the final picture. Now we are doing a hysteroscopic directed curettage. The pressure is kept at around 70 to 80 mm of mercury, and we managed to do it even in such a low pressure. Now here we get the final picture almost. We are almost through. This is the final picture. Thank you.